There we go. Now we are recording. So welcome to the Where Next webinar, where I'll be answering your most pressing questions on career development and job hunting in global and public health. My name is Candela Iglesias, and just to start with a little bit of my story and why I'm holding these webinars, I actually did not start my career in public or global health. I started in the biomedical sciences and worked for 10 years in that area, trying to build up my career and my credentials. And about 12 years ago, I decided that I had enough and I wanted to change. And it was quite challenging because I had no idea of what the field was about, what the global and public health field was about, or what would be interesting for me. So it took a while, and it took over a year, but eventually I managed to switch careers to public health and global health, and I got a fantastic job at the hospital in Mexico, leading a team of mental health professionals. And from there, it just continued growing to different opportunities. So I went on to work in the humanitarian sector in global health, and I worked over 10 or more countries in the world, having the opportunity to work with governments, with NGOs, with academia, with the pharmaceutical sector, and with many of the actors that we have in global and public health. So I'm going to be talking a little bit more about those opportunities today in this webinar. So what are we going to do today? I'll start by answering 3 questions that are the questions that I get most from people who ask me for a coffee or for a chat. Many of these questions I've also had from our interns at Alanda Health, and they are the ones who have shown me that there's a lot that we are not teaching students in their masters in public health or global health or similar areas. So we need to get better at this. But hopefully, in the meantime, this webinar is a way for you to get some of the responses that you're looking for. So I'll answer these 3 questions. What are my career options outside of academia? Should I do a PhD? And why do I keep getting rejections or no answers to my job applications? These are the 3 most common ones we get. And then I'll answer your questions. So be sure to come prepared. You can start adding them right now, or you can add them later in the chat, or in, there's like 2 little different windows. One says Q&A and one says public chat. So in any of those, you can add them. It's fine. If you add them in the Q&A panel, that's best. And then at the end, I'll close by talking a little bit about some additional support that we are providing and some guidance resources, and an introduction to a course that we are providing as an extra resource for people interested in career development in global and public health. Okay, so let's dive into it. What are my career options in global and public health? Big question. And I think what happens is that most of us, we do a master's in public health, or a master's in global health, or a master's in health economics, or whatever it is. And we know the academic world quite well. Many of our professors, are academics themselves. They do research. So the public health research component inside academia, we more or less understand. But what about other options? What else can I do with a public health degree or a global health degree? Or if many of you might have a medical degree or a dentistry, and you're just starting to switch into public or global health. What are the options? It turns out there's a lot of different options in a lot of different institutions. So let's map them out. First, of course, you have academia, and I'm not going to talk a lot about that because that's the thing you're most familiar with. Then you have NGOs, so you have not-for-profit organizations, and many of these not-for-profits, whether they work in the what we call the development side or the humanitarians or more of the emergency side, they might have health programs and public health programs, right? So when we talk about health, we're normally talking about, potentially a medical or clinical component, and usually a public health component. And that is, it can include things like water and sanitation, public health, surveillance, epidemiology, mental health, psychosocial support, first first the psychosocial support to populations in need in an emergency, etc. What NGOs are out there? Here's the interesting part. The ones you hear about might be the big ones, right? The ones top of your mind might be Doctors Without Borders, the Red Cross. It might be Save the Children, Plan International. These care, so the big international humanitarian organizations. But not-for-profits and NGOs, they go all the way from the big international ones to super local ones. So there's something for everyone. You might want to go into your own country's databases, wherever you can find them, for NGOs, and ask around what are the NGOs in my country. And some countries have smaller, medium-sized NGOs that work both internally in the country and also internationally. So if you're looking to work internationally, this might be a good option. Local, grassroots organizations that are working either on advocacy or community support, a lot of very interesting programs. This is always also a great place to start. Of course, they don't necessarily have a lot of means, but there's at least a possibility to volunteer and for you to start understanding a little bit better what public health work can look like. We also have what we call multilateral organizations that work in more than three or more countries. The first one that comes to mind, of course, is the UN system. And inside the UN system, we have a ton of different organizations that work in public health, not just WHO, which is probably the one that comes top of your mind. So we have WHO, but you have UNAIDS, for example, working on HIV. You have UNICEF, who works on maternal and child health and does a lot of vaccination work. You have UNDP, also has health programs. So you have a variety of different organizations within the UN that work in public or global health. You also have other multilaterals, or some of these are what we call public-private partnerships, such as Gavi, the Global Fund for HIV, Tuberculosis, and Malaria. Gavi is the Vaccine Alliance. They work mostly on vaccination. The Global Fund for HIV, Tuberculosis, and Malaria, which has a lot of health system strengthening programs, so not just HIV, TB, and malaria. You have, of course, then you have the foundations, the big foundations like the Bill and Melinda Gates, who does a lot of work in health. But you have smaller foundations in different countries and many of them have health programs, whether nationally or internationally. In general terms, the bigger the organization, the bigger salaries and the more, sort of opportunities you may have. And the smaller the organization, the smaller the number of opportunities and the smaller potentially the pay. But it's not always the case. Apart from multilateral organizations, you have governments, right? Governments are a key player in everything that's public health in their own countries. And by governments, yes, the Ministry of Health, but now more and more with One Health, there's opportunities to work in public health aspects through other areas like agriculture or veterinary or animal farming services, etc. There's even opportunities opening up in environmental departments, for instance, right? Bringing in this One Health approach. You would also have, Ministry of Health, remember, it's everything from the big national central Ministry of Health to all its ramifications across a country, to just down to the local level. And there's need for public health specialists and across all those levels. There's also the National Institutes of Public Health of each country, and many of these, some of these actually have also not only national programs, but international programs. They usually have a very specific mandate that has been agreed with the Ministry of Public Health or with the government. And they do research, but they also do surveillance and monitoring. They might have some component, in health systems strengthening. So different national institutes of public health have different mandates and roles. So you would need to look into what your own country one does. We also have I've talked about NGOs, I've talked about foundations, I've talked about multilaterals, I've talked about governments. You have the private institutions, right? Yes, the big biopharmas, the big pharmaceutical companies, they might need people with public health knowledge or global health knowledge. So also many of those big pharmas actually have foundations that have health programs, so you might want to look into those. And we also have smaller private organizations that provide a variety of different services to all these other organizations that we've talked about. So think about, organizations working. So of course you have everything that it's evidence and research, journal publications, medical journals, public health journals. So all the publication space, I would say. And some of them are not-for-profits and some of them are for-profits. You would also have the service providers, so organizations that provide services to the UN through either consultancy or advisory services, or providing different terms, for example, providing trainings or providing supplies, providing different types of support. And of course, there's relief organizations that don't necessarily work in public health, but they might have some public health components that might be useful. So a huge variety of opportunities right there. And don't let anyone convince you that going into academia is the only path. Of course, it's a fantastic path if that's what you choose, but it doesn't have to be the only one. And one last thing, universities and academic institutions are not just your only possibility for doing public health research. You can do public health research in NGOs, in organizations such as the Bill and Melinda Gates, in Gavi, inside the UN. You can do research, you can do operational research. For example, MSF has this fantastic center that leads all of its operational research that's called Epicentre. But many NGOs are doing more and more operational or implementational research, so much more hands-on, like what does an intervention look like? Is it working, etc.? And you have these fantastic organizations such as ACAPS that are working on collecting, secondary data and analyzing huge amounts of secondary data to provide services to the first responding organizations or the organizations on the ground. So hopefully this brief overview gave you a little bit more of an idea of what you can expect in terms of jobs or potential opportunities for employment in global and public health. Let's move on to the second question. And if you have any follow-up questions on the first one, just type them in the chat. Excuse me for my cough. It's not COVID. The second question is, should I do a PhD? And I wish I had a better answer than the one I'm going to give you, but the one I'm going to give you is, it depends. My recommendation is always, just make sure that you're doing a PhD for the right reasons. So ask yourself first, why is it that you want to do a PhD? If that answer is because I can't seem to find a job, if that answer is because everybody seems to have one, if that answer is because I don't know what to do next, I would say stop, pause, and rethink about it a little bit. Because that is not necessarily the best reasons to go into a public health degree, to go into a PhD degree. Either a doctorate of public health or a PhD, it's a lot of work. It's very intense for quite a few years. And of course, in a way, you continue being a student, right? So you have not necessarily entered the professional environment or the job environment. So depending on your reasons, what are some good reasons to do a PhD? I think good reasons to do a PhD is because you really want to do research, like you really want to specialize in doing research. That's your thing. Then by all means, go ahead and do a PhD. The other is that because you're extremely curious about a particular subject and you want to have an opportunity to delve deeper into it. That's another fantastic reason. Go ahead. But if it's just because you can't seem to find a job, I would say stop and pause. It's not because you have a PhD that is going to make it easier. It's okay also to say, I actually want a PhD because I want to have the credentials. I think those credentials will help me. I'm not sure they will help you. They might in some scenarios, if you want a very high position, especially if it is a research position, but potentially, a high position in a national or a leadership position in a National Institute of Public Health, it might, having that credential of a PhD associated to your name might help in certain situations, but not at all. I mean, when you think about the leaders of many of our organizations, yes, some of them are medical doctors or PhDs, but in many cases, you have people who have, climbed the ranks as administration experts, as management and as leadership experts. So it's not necessarily the answer to have that PhD. So it's just delve a little bit deeper into your reasons and think about it in those terms. Whenever it's about you really caring about research, that might be the right answer. But again, there's other ways to do research which don't necessarily require a PhD. You could just start working in an organization that does a little bit more research. But if you want to climb the academic, and if you want to be in academia and you want to climb the academic tree, then you most likely will need one. Okay. Also, if you have any follow-up questions on that, please just input them into the chat, and I'll answer them afterwards. Now, question number 3. This is where things start to get a little bit intense. Why do I keep getting rejections or no answers to my job applications? This is so common. So the first thing I want to say about it, it's very common and it's not you. I know it sounds fake, but believe me, it's not about you. It's not personal. The systems are not very good. I think, in the corporate world, many organizations are trying really hard to improve their recruitment systems so they don't leave people, this term ghosting, where they basically don't respond. So they don't leave people hanging. I think we have a long, long way to go in the not-for-profit sector or the multilateral sector in terms of being better recruiters. So in the UN in particular, it's almost impossible to get a response. If it's a negative response, it's almost impossible to get a response to any applications that you've sent in. And that can be really, really discouraging. It can feel really personal to get a rejection or to not get any answer. And it's, like, what am I going to do next? How do I manage this? And when you send out 50 or 100 job applications and you don't hear back from anyone, and the 5 that you heard back from were rejections, you start to take it personally. It's very hard not to. Let me tell you a bit about my story. When I first tried to switch into public health and global health, first I had no idea how to transform my CV. My CV was purely academic, was purely lab-based. I had a list of 10 or 20 techniques that I knew how to do in the lab. I was fantastic at those. And then a mentor saw my CV, which was, of course, 10 pages long with all my publications and all the conferences I had ever been to. And they were like, yeah, this needs a little bit of tweaking. So yes, there's things you can do to improve your CV, to improve your cover letter, to improve your chances. But a lot of that, having, like me, having sent out 60 job applications, getting 5 responses, and 4 of them being a rejection and never receiving a response to the other ones, that's a systems problem. That's not you, okay? So there's 2 reasons, or there's at least 2 reasons that I think are particularly critical, and that we don't explain these things to students in their master's degree when they're about to start reaching out into the job market. So I'm going to talk about these 2 reasons very briefly here, but read a little bit more on these. The first one is what I call the iceberg effect. if you imagine a whole iceberg, a big chunk of it is underwater, and just a tiny, tiny piece of it is on top of the water. That's the part that's visible to us. From the whole of the job market, and this is true for public health and global health, but it's true for many other disciplines as well, the jobs that are advertised are just the tip of the iceberg. There's between 70 and 90% of the jobs are never advertised. And of course, this changes from sector to sector, country to country. There's a lot of variety, but between 50 and 90% of the jobs will never be advertised. So then if you are only applying to advertised jobs, if you're looking in Relief Web or whatever website you're Impactful, whatever website you're looking into, those are just the advertised jobs. You're missing out on 50 to 90% of the opportunities. And we'll talk later about how to target those jobs that are never advertised. But what are these jobs that are never advertised? It's normally jobs that are given internally in an organization, to an internal candidate. It can be jobs that are, just shared internally in people's networks to look for candidates that are recommended within that network. It can be, and this is, many organizations, especially governments and some big INGOs and the UN, they have, strict guidelines of what's allowed or not. So a lot of them have actually to post every single one of their job offers. But that doesn't mean that they don't already have an internal candidate for it, okay? So even if you see the posting, some of those postings will already have an internal candidate that they want to recruit, but they're posting it because they're obliged by the system. I'm not saying this is fair. I'm not saying this is the way to go. This has a lot of biases. That's a topic for another discussion. Right now, I'm trying to help you think about how you can work around this system. So if you're only targeting jobs that are advertised, you're wasting your time, or you're wasting a big chunk of your time. I'm not saying don't ever apply for an advertised job. I'm just saying that's not where most of the opportunities are. So what to do instead? This brings us to problem number. Okay, what to do instead? The answer to this lies in your networking and your relationship building. And hear me out. I know that a lot of people hate the term networking, but it's not about, trying to please someone to get a job. It's trying to build the relationships that allow you to be in the right place at the right time when there is an opportunity. Because another part of these jobs that are never advertised are jobs that are created on the spot for a person that someone likes. Like I have a need for whatever it is inside my organization, and you come and I meet you and you say, you know what, I'm looking for a job, and I know that you're fantastic at doing A, B, and C, and I'm like, well, I had this need. It was not a priority, but now that you come to me, it's like, oh, I want to work with you. Let us create a job for you. And these things happen a lot, okay? So building on those relationships is for you an opportunity to be there at the right place at the right time. Then the other problem, and then I'll stop on this and I'll start answering your questions. But the other problem is around what I like to call gatekeepers. So gatekeepers are the people whose job is to keep people out of the organization. So if I send a job application to WHO for a particular job offer, there's a huge bunch of HR people whose job, and they're not mean, right? But their job is to keep 1,000 people out and let 5 people in for interviews. That's actually in their job description in a way. You see what I'm saying? These are the gatekeepers. When it comes to networking and relationship building, it's not necessarily these people that you need to be talking to. You need to find ways in through the back door by building relationships with your peers. There might be fantastic people in HR. You might have great friends there. You can learn a lot from them. But the people who ultimately decide if a job is created or not, hand in hand with HR, is the technical people. And these are your peers, right? These are your people. It's the public health experts, the public health advisors, the project managers, the technical leads, whatever it is they're called. These are the people that you want to build relationship with. Go through the back door. Avoid those gatekeepers. So how do we build relationships? We can speak a lot about this, but basically you need a strategy. You need a plan. If you randomly reach out to people on LinkedIn, it's better than nothing, but that's not the way to go. What is going to be your strategy? Which organizations do you really care about? Which organizations would you really like to work in? Make a list of people working in public or global health positions in those organizations and start to try building a relationship with them. It's not about just going out and saying, hey, can you give me a job? That's not going to work. It's about, getting to know the person, asking them out for a chat or a coffee and saying, hey, I'm really curious about this organization. I'm not looking for a job right now, but in the future, I would love to know more about this organization to see if it's a good opportunity or a good place to work for me. Can you tell me more about what your job looks like, what your day-to-day looks like, and what would you recommend working for this organization? That is completely non-threatening to the other person because you're not asking them for a job. So this is a really good approach. It's not an informational interview. It's just a chat because you're asking for their advice and for their knowledge about how things work inside the organization and what does the organization do in the day-to-day? What does a day in the life of look like? The other really good approach is actually asking people for specific advice. You can reach out to people on LinkedIn or on other platforms and say, hey, I'm going to graduate recently. I'm going to graduate soon from a public health program. I'm reaching out to people I admire or who work in organizations that I find interesting to hear their best advice on how can I develop my career and what are interesting areas or interesting organizations that I should be looking into. Again, completely non-threatening. We're all human beings. We all love to give advice. That's really a very easy ask from your side. And most people will say yes. Don't ask for an hour or an hour and a half. People are busy. Ask for 20 minutes. And, some people will say no, but a lot of people will say yes. So hop on those 20 minutes. And at the end of those 20 minutes, key question. Thank you so much. This was super useful. Who do you think I should talk to next? Get a name, because then you create your snowballing sample. And you all know about snowball sampling, I guess, from your studies. So that is the strategy that I would propose. Great. That was a lot of me talking and answering those first 3 questions. Now it's time to hear from you. So I'm going to spend the next 20 to 25 minutes answering your questions in the chat. So feel free to go in and start typing. It can be follow-up questions to everything I've already talked about or any new questions that you have. Okay, I have a question here that says, if you're a young medical doctor with a master's degree in public health but no experience in the NGO field, but experience in clinical settings, all the organizations keep saying you do not have an experience. What do you encourage me to do? Yes, the experience conundrum, isn't it? It's like, oh, it's an entry-level job, but we want 3 years of experience. What? I think a lot of this, so you have part of the answer, and part of the answer is systemic, so we can't do much about it. But the part that you can work on is how you present your CV. How do you tweak your CV and your cover letters to give really good examples of how your clinical practice and your clinical experience or your volunteering experience or your experience working for projects in your school or in your master studies provide that experience that they're looking for. So it's a matter of how you present things. And a lot of that could be around transferable skills, right? Like there's a lot of medical doctors that come to me and say, oh, but I don't have a lot of transferable skills. Like, I don't know anything about science communication. Are you kidding me? You're talking to your patients and trying to explain really difficult medical concepts to your patients. That's science communication, right? So it's about talking to other people who know you and know your strengths so that you can retweak a little bit how you see your own skills, because we're very biased when it comes to our own skills. So how do you write them differently in your cover letter, in your CV, so that experience comes out? The other option, of course, is trying to get some of that experience through voluntary work. And if you're a medical doctor with some clinical experience, many organizations, especially humanitarian first responder organizations, have what we call rosters, where you can enroll in a roster, get some training, and go out in an emergency. And of course, a lot of smaller local organizations will always welcome doctors, medical doctors or other clinicians with arms open, especially if they're willing to volunteer some of their time. So that's another option. Okay, would you say a master's in public global health is required to enter the industry? Coming from private healthcare consulting in my situation, or can I enter the sector without a master's? Again, I think it really comes to how you position yourself and what is your hook. What are you going to use as a hook to open that door into this new sector? If you come from private healthcare consulting, you definitely have a lot of facilitation skills, advisory skills, communication skills, a lot of these transferable skills that are really useful. You need to understand and learn, the technical components of the work for some positions, but not for all. For a project management position, you don't need to be an EPI specialist. You don't need to be a public health specialist. You need to be really good at project management, for an advisory role on communications, so there's different possibilities and different positions where you can start opening the door and take that first step that allows you to say that you have some public health experience. Me personally, I decided to do both at the same time. So I got a new job and I started doing a master's in public health at the same time. And my reason for it is because I know that my best learning style is the classroom style. So I needed the theories, the frameworks to think about things. And I knew that the easiest way for me to do that in a manner that would feel easiest was through a structured academic course. But that's not the answer for everyone, because we all learn in different ways. You might just want to take random courses online. I mean, there's so much material online today. It's amazing, and we can all take advantage of that. I hope that answers the question. If I'm not answering your question in full, feel free to retype in some clarifications. I completed my master's in global public health from the University of Essex in the UK. I do have knowledge of qualitative and quantitative research, knowledge of literature reviews, and an interest in health inequalities. I started applying from some of their research assistant roles, but I haven't gotten any positive responses. I'm interested in health educator roles as well. So can I apply for health educator jobs without any experience? It really depends on the role, right? Like, what can you bring into a health educator role? If you can answer that question, here's the thing. I see a lot of this in the young public and global health professionals that apply to Alanda for internship possibilities. I would love to have the time to help each of you look through your CVs and your skills and find a way to highlight those skills that are important for the job. But I don't, and neither does any organization that wants to recruit you. So the thing is, you need to do that for yourself. You need to be able to answer the question, if I want a health educator job and I say that I don't have any experience on a job that actually the title reads health educator, what other skills, what other things can I bring from my own background? And you already mentioned some of these, right? Like qualitative research, quantitative research, literature reviews, etc. Sometimes it's a language barrier. It might be that in the health educator roles or in the health education sector, we don't use the same jargon or lingo that we use in, more academic or research roles. So you might want to explain how is that your quantitative research or your qualitative research is valuable to a health educator role, right? For instance, top of my mind, I am very good at making, summaries of all the evidence base for a particular learning approach. I can do that for your organization, right? So it's your job to say, hey, this is how I can bring value to your organization or to this particular role. Okay, and it requires a little bit of thinking out of the box and getting rid of all the jargon. What are easy ways to talk about qualitative research or quantitative research? What are good examples that people can understand, even if they're in other sectors or disciplines? Okay, so I hope that more or less answers the question. Thank you very much for your answers. I've just graduated with my master's degree in public management, and I focus on public health and pandemic management. Prior to my previous experience in COVID-19 management, I would like to shift my career to health policy, including research in this area. In your opinion, do you think it's necessary to have a degree in public health to work in this field? No, again, not really, not always. It depends. How do you get your first foot in the door? So your first foot in the door might be with your public management degree, right? With a public management degree, what can you bring as value for a role in health policy that people with a public health degree might just not have, right? That understanding of the administration, of the policy process, etc. And then, they will partner you up with people who have the technical components and don't have the public management or understanding of administrative systems. So it's always answering that question. With my own degree today, what added value do I bring? How do I can help you solve your problem? Okay. And if you answer that question well in your cover letter with good examples, that opens a lot of doors. And of course, we're going back to the same problem we already talked about. Relationship building, networking, because those are where you have opportunities to bring out that value in more detail than just applying to a regular job. The problem is that in the bigger organizations where they actually use robot, like softwares to sift through the 1,000 of applications that they get, they have keywords. They might have, health policy or health research as a keyword. So if you don't have that keyword in your CV, it'll automatically get sifted out, right? So whenever you think it's a very big organization and they probably have some automated systems, think about what are the keywords in that application offer, in the description of the job that you need to put into your CV somewhere. It doesn't, and this is something that I also explain, it doesn't matter what the real title of your previous job was. What matters is what you did inside it. So as long as you're not cheating, as long as you're not saying something that is entirely not true, it doesn't matter if you give a brief description of what that job application, what that previous position was about, right? So you might say, I was a public administration manager. That doesn't, if I'm looking for a health policy professional, that might not give me any clues. But if you said, I worked with this team on public health policy, or what we did here, this project that we did here influenced public health policy, you need to find those ways of explaining what you did in a particular position. If I'm not in a particular field, I have no idea what the title of your job means. So if you only give me the title of your job, I can do nothing with that. Learn how to give a little bit more information about your previous roles or positions, or even about what you did in your master's programs inside your CV and your cover letters. That can be really helpful to the other side, and of course to you. The same job is being advertised by different organizations under different job titles. So in my job search, I am unable to find all jobs. So which job titles should I use to search for health educator, research assistant roles, and so on? Yeah, that's a common issue. We actually created, with the team at Talenda, we actually created a list, not exhaustive, but at least a starting list of potential job titles. But it really depends what you want to do, right? Like health educator, research assistant. It could be there's could be project manager, program manager, health advisor, public health advisor, health education advisor. the list is infinite. So you need to get really creative and just try out different search terms and see what you're getting into. And, just keep larger keywords instead of looking for specific job positions. But we do have a resource in Alanda, and we'll find a way of getting it out to you all. But as again, I said, it's not an exhaustive list. So keywords instead of position titles, I think that is the way to go. And there might be a lot of garbage that you're not interested about, but then you'll sift through it, but you won't miss any of the interesting roles. I just graduated with my master's in public health in June 2022. I have 6 years of experience in pediatric clinical nursing, plus 1 year of experience in academia and clinical research. Getting rejections and not hearing back, that's tough. I've applied to a mix of NGOs, city governments, academia, clinical research. I've been in contact with my professors who have been trying to help, but I feel like I'm getting nowhere. It's really hard. I don't have an easy solution except to keep trying, and to keep trying with the two things we've been talking about. Try to build a relationship so you can target the jobs that are in the underwater part of the iceberg, and try to avoid the gatekeeper. So just keep on building those relationships. Really get very targeted on the organizations that you really care about. Make a list of 10 or something, and really try to meet people who work there, to create those connections, to maintain those connections. It's not a one-off thing. It's a long-term approach. And I know, it doesn't solve the problem of me needing a job right now, but you can do 30% of the random job application approach and 70% of the relationship building, or at least 50-50, but try to have a bit of those two components there. And the other thing I normally say to people who are job hunting is, remember that job hunting is basically an exercise in rejection. No matter how good a candidate you are, if you're actually sending out random job applications without a real connection, your rejection rate is going to be extremely high. And it's not personal. It feels personal, but I swear it's not personal. It really helps to talk to people on the HR side, people who have gone through this process on the other side, in the company or in the organization side. Many decisions on who to hire might rely, you might have, 10 really excellent candidates, and you still need to choose. How do you choose among those, right? So in many cases, in the end, it's not personal. The other thing I would like to say about that is, as many things in this world, the binomial, the normal distribution, it also applies to job hunting or to, the job applications. So when there's a job offer, what happens is that as an organization, you get a normal distribution of CVs. By that, I mean that you have some CVs on the tail on this end that are really, really bad. Some CVs or some applicants that their applications are not the persons, but the applications are really bad. That doesn't say anything about the person, except that maybe they don't know how to play the game. They have not been taught how to play the job application game, okay? It really says nothing about the quality of the person as a professional. And it's always important for everybody to remember this. But the applications are poor, right? They're not well written. They might have typos. They're all over the place. They're not very clear. The cover letter might be very weak, etc. Then you have, the big chunk of the curve, of the normal distribution curve, and the majority of the CVs fit in there. So you have a ton of the CVs that you receive that are good. Not bad, not excellent, but good. But what happens? You also have the other little tail. You have that tiny little tail of CVs that are excellent, that are really good at, for particular reasons, really stand out. So how do you move your own CV and your own cover letter from that center of the distribution, it's good, it's solid, nothing to say about it, to that tiny little tail where you have the excellent ones? Because the truth is, most likely they will select candidates for interviews from this tail over here. I hope that makes sense. But then, there's tons and tons of resources online on how to write strong job applications, how to write strong cover letters and CVs, and you need to have some of those basics really mastered. That is really important, and that's what you can do on your side. There's parts of the system that we can't really change, or it will change little by little, but there are some things that you can do for yourself. Just making sure that your CV and cover letter are checked by people, not necessarily in academia, because as we know, CVs might look a little bit different in academia, but in the type of organizations where you would like to apply for jobs. I hope that helps. I know it's super hard. Thank you for the interesting presentation. I'm from Cameroon. I completed my master's in clinical biology and recently graduated from an MPH. Can we have a template for a good CV? Oof, it would be very presumptions for me to say I have the best template for a good CV. Just Google good CV templates and you'll find tons of it. I mean, even Microsoft Office Word these days has a lot of very lovely templates for CVs. Try Canva. Canva is a free app, a free software. Just type Canva on your Google search on your browser, and you'll find it. And they also have tons of free CV templates that are completely lovely. Keep them short. People don't have time. Don't write, 1 page if you're junior, 2 pages if you're a little bit senior. That is more than enough. And then use your cover letter to really talk about the good examples. Are you suggesting as part of our strategies to walk into an organization and then talk to them to give me an opportunity to show them my skills? No. No, because that is threatening. And by threatening, I don't say, it's scary, but people don't like to be asked for jobs. That is a reality. I don't like for anyone to come and say, hey, do you have a job at Alanda? I would be interested. Yes, but I don't know you, right? The first like impulsive reaction is, yes, but I don't know you. So what I'm suggesting is that you get to know them. That is your job. That is your relationship building part. That is your networking piece. You start talking to people that you find interesting in the organizations where you find interesting, and you keep building on those relationships. You send an email now and then, you send on LinkedIn, you send a congratulations. You start writing about what you're good at on LinkedIn, just little bits and pieces and posts. You need to be top of people's minds. And then you ask them out for coffee and you say, I would like your advice, or I would like to understand more about how your organization works. You never, ever, ever ask for a job. You never, ever, ever say, hey, can you give me an opportunity to showcase my skills? The only time where you say, can you give me an opportunity to showcase my skills, if you're potentially asking for an internship or a voluntary position. Otherwise, they're getting a lot of candidates. So unless you build a relationship with them, most likely the answer is going to be no. That's what I would, by all means, go ahead and try it. I don't want to say I have all the answers, but that's what I've seen a lot. Are there other ways to start your own public health work, like consultancy work? And how can young professionals use public health knowledge in blogging? Lots of different ways. There's lots of people out there, very young professionals, who have said, you know what, I don't care. This system is, I'm just going to start talking about what I care about. And there's many ways to do it. You can start a blog, you can start a podcast, you can join other podcasts, you can contribute. Podcasts take a lot of work. There's a lot of fantastic podcasts in global health and public health. And if you say, hey, can I jump in to not to necessarily be a guest, but to help you find good guests and to help you with all the back end work, they'll be, and if you are willing to do that voluntarily, they will be very happy to have you. And it's a great way to get to know people and experts that they are interviewing as guests, for instance. But of course, you can start your own podcast, you can start your own blog. You can start your own consultancy. I think in general, in consultancy, there's a certain bias towards more seniority because you need to prove that you've done it before a little bit more, because sometimes it's a lot of sensitive topics and you're coming in as an outsider into an organization and they need to be able to trust that process. It doesn't mean that it doesn't work, but there's also a lot of big consultancy companies that are much more willing to take in young junior people, and of course they pay quite well. So there's a lot of I forgot to talk about those, but of course there's a lot of consulting organizations, and the big ones like KPMG and PwC and all of these ones that are, or were more about leadership and management and legal and so on, are now getting into international development. So public health is one of those areas in international development. So how to use public health knowledge in blogging? What's your niche? What's the subjects that you're passionate about? And start writing about them. Just make sure you're evidence-based. I'm a medical doctor. I'm currently doing my master's in public health and international development in the UK, but I am an international student. I'm interested in health systems and policies. How can I find organizations in the public health sector in the UK that would be willing and able to sponsor a UK work visa for international applicants? This I get a lot. It's a really hard question. I don't know that I have the right answer, unfortunately. I think my advice is still the same. Go through the back door, build those relationships. Use the years of your master's to build those relationships. You are not, you're not ready to go out into the job market right now. So use those years of your master's, spend at least 4 hours a week doing networking, building relationships, building connections, talking to people. That is a fantastic investment of your time. And the other thing I would say around that is it really depends on the type of organizations. Some organizations are very used to sponsoring visas and others are not. Look for the organizations that are. Which are those? UN in general, WHO or whatever. Local governments, not really. I wouldn't think so. Research organizations, they're quite used to it, but they don't always want to do it or have the resources, financial resources to do it. International NGOs are very used to doing that. The Red Cross, Save the Children, all the big ones, they do that all the time. It's not a problem. It's like, sure, we want applicants from everywhere. So just find, there are some organizations that are better at the sponsorship part than others. So just look at which ones for which of those are interesting for you and try to build connections in those. I would say that's a good approach. But it's a tricky one, and I don't have the answers really. My global health program started last September, and I'm struggling to find a way to build relationships, network with my peers due to the fact that I'm introverted. Do you have any tips on how to build rapport relationships for those who find it challenging? Yes. It's so much easier for extroverts. I'm just in the middle of that spectrum. But yes, I think one of the tips that works best for introverts is let's have one-on-one chats. If going to a large networking event is super stressful, can you just invite one person that you're interested in talking to or building a relationship with to a 20-minute coffee or virtual chat or whatever, something that feels very non-threatening to you, that feels fine, that you can do. I think that's one good way of doing it. Another approach that some of my introvert friends use is bring them to you. So be the organizer. Say, you know what? Me with 3 of my friends who are people that I feel comfortable with, we each bring one new person and we do a dinner together or a potluck party, or we go out for coffee, whatever, it doesn't matter. But each of your friends brings someone that you don't know. And that it's in the field, or that you can have certain specifications. And that's a very safe way because you're with your friends, and there's, some of the people are new people and some of theirs are your friends. So being the organizer and being the one who has the control of how that networking event works and keeping it small can really be helpful. We still have a ton of questions. I'm going to have to stop now. Before we end, I want to talk to you about other resources, in particular one resource that we have developed at Alanda. And this is a resource that has been developed mostly by our interns, who are young public and global health professionals themselves, and who had a lot of these questions as well when they started their internships at Alanda. So we built this together, and this Thrive is a course on how to build a meaningful career in global and public health. So we tackle a lot of the topics that we've been discussing today, where we can only, barely scratch the surface in this webinar. So if you feel like you need additional support, You can look it up. If you look Thrive, How to Build a Meaningful Career, you'll find it. We'll send you the link with the recording to this. What the course is composed is, it's 6 video-based trainings, each with its own challenge. So we actually take you by the hand to make sure that you take the steps to improve your CV, to improve your cover letter, to develop a networking strategy, to start reaching out to people, all the things we've been talking about here. So they actually take the steps to do those things, that it doesn't rest in, a little bit in the air. We have a lot of materials that we've been talking about today in there, lists of positions that you should use as, that what the different position titles mean, where can I actually look for jobs, the different types of organizations that are potential or organizations where I could work, etc. So I really encourage it to take a look. I think the strongest component of this Thrive is that we actually have a couple of internal webinars that happen through Thrive. One similar to this, where people can ask me on any of their questions, and one with some guest panelists. So you can have, a little bit of a feeling for what different careers in public health can look like. And the other really good resource is that we have a community. It's called the Thrive Community. It's a closed community for people who are taking or have taken the course. And it's, this is what I always say, job hunting is super hard. You should not do it alone. So having that community to help you, to support you, to encourage you, to answer your questions, to share resources, to take a look at your CV, to take a look at your cover letter, to exchange CVs and cover letters and say, hey, I think you have these skills that you're not really highlighting very well. That is something that our participants have told us is the most valuable piece of the course. So I encourage you to take a look. We are launching the new cohort. We work by cohorts, so we're launching the new cohort on the 1st of February. So there's about 2 weeks to register for the course, and then you get weekly emails with your weekly tasks. So we try to make it as easy for you to follow the program. Hopefully it helps. It might be that with this webinar was enough, and in that case, I'm super happy. There are a lot of questions that I did not have the time to answer. So what we are going to do is we're going to save the chat, and on our LinkedIn, on Alanda's LinkedIn, we'll be trying to answer some of these questions without all the personal parts on our LinkedIn posts in the next few weeks. So stay tuned. If you're not following Alanda on LinkedIn, that's a good thing to do, so you can actually see these posts and these answers. And you'll get an email with the video recording of this webinar by tomorrow. And you'll also get there a link and a little bit more of an explanation of the Thrive course that starts on the 1st of February. Thank you so much for being here. Keep on, moving forward. I know it's hard, but we really need all of you public and global health professionals in the right positions, in the right careers, feeling empowered to do fantastic work. So thank you so much for being interested in your career development and for joining today. Really happy to have you here.